Hi, my name's Carrie. I currently work for Abbey Medical Practice. My main position here is a receptionist coordinator, whereas I look after the staff here, asking any questions and supporting them in their role. Additional to that role, I am the cancer care coordinator, a very similar situation, whereas I would then look after the patients, supporting them and guiding them.
Thanks, Carrie. So I'm Dr. Ali, one of the GP partners here at Abbey Medical Practice. One of the particular areas of interest I have is with cancer. I also happen to lead on cancer for Northants CCG. And with Carrie today, would like to talk to you about the FIT test, which is linked to bowel screening.
So I'm going to start with some of the questions that I'm regularly asked by patients. Why do I need to have a FIT test?
Okay, so I think that's a really good question. So I think, just if I just go back a step, so the FIT test is essentially a stool or a poo test that detects small amounts of blood in your poo. FIT stands for fecal immunochemical test, and the whole purpose of the test is to try and detect bowel cancer at very early stages. So as mentioned before, it sort of detects small amounts of blood in your poo. And currently it's reserved for patients who are between the ages of 60 to 74. So patients in that age range get invited to do the stool test every 2 years. But the plans going forward is that to extend this so that patients to the age of 50 will be able to have this test again. So it'll be good for them because they'll be able to pick up bowel cancer earlier as well, because obviously bowel cancer doesn't just happen in the age range of 60 or 74. As mentioned before, what it does pick up is blood in the poo. So now that can be various causes, but the two main things that they're looking for would be when you have a FIT test is whether it could be a polyp, or which is basically a fleshy growth. Now some of these polyps are completely harmless, but some of these polyps then grow to become cancerous, or it could be early stages of cancer. So that's what the test is looking for. Obviously, again, it's really important that if this test is done and you do pick up cancer early, the treatments are curative, they're far less challenging and difficult for the patients, and the outcomes are so much better for the patient. So in a nutshell, it's an excellent test to have done, because if you do, God forbid, pick something up, you'll have much likely to have better outcomes.
Okay, thank you. Okay, so another question, what if I am unsure to do this test?
Yeah, so that's a question we get asked quite a lot, because it's not straightforward. So what will happen is you'll automatically get invited via the bowel screening department. So they'll send you an envelope which has the kit inside it. Now, without being too crude, essentially the kit is a stick that's inside a pot, and that stick you essentially have to smear into your poo, put it back into the pot, and then send it back in the stamped addressed envelope back to the screening department. What we will do with this video is send you a link so that it's easily to follow, because obviously I'm just very briefly explaining it, but it is fairly straightforward to follow. I think the other thing to just bear in mind is it does take about 2 weeks for that result to come back. So if you don't get a result back in a week, don't worry. About 2 weeks is when those results are turned around.
Okay, thank you. Okay. I'm getting on in age. Do I need this test?
So I think that's again a common question that we get is so why should I bother, essentially. I think, as I've sort of touched on earlier, when you do a FIT test, it picks up small amounts of blood. If there are small amounts of blood picked up, you then go on to have another test, which is essentially a camera test, a colonoscopy, that looks into your bowel. Now, at that test, if you do have polyps or early cancer, these can be removed. So if you think about it, you could, at very early stages, have bowel cancer. It could be removed, and you wouldn't need any sort of major surgery or chemotherapy or anything like that. So that doesn't really matter how old you are, because most people are fit enough or active enough to be able to have this test. The worry is when patients sort of decide to perhaps ignore the test and then go on to develop symptoms. Then usually, once you've started developing symptoms, the cancer is a bit more advanced. Now, when it's more advanced, then things like bowel surgery, chemotherapy, these are really difficult things for patients to go through. So it's much preferable to obviously not have cancer at all, but if you do have it, pick it up really early, have a treatment that can hopefully be curative, and then be done with it, really. And that's the whole point of the screening.
Okay.
Yeah.
My final question is, if something is detected and picked up in that sample, does this mean I've got cancer?
So again, as we touched on earlier on, so the FIT test picks up small amounts of blood. So blood does not necessarily mean cancer, but it can do. So the next test that would normally happen, so most patients will have a negative FIT test. You don't need to worry. 2 years later, you'll get another test. But the ones that do have a positive FIT test will then usually go on to have a colonoscopy. So a colonoscopy is basically a camera that's popped inside a thin tube that goes around your bowel. And it goes around your bowel, has a look into the bowel to see if there are any polyps or any cancer, or, you know, what the problem is. And if needed, some of those polyps can be removed there and then. So again, as touched on earlier, it's if something is there, God forbid, it can be managed and dealt with a lot quickly. But just to answer the question in a nutshell, just because you've got a positive FIT test, no, it does not mean you've got cancer. It means there's something going on that we need to look into. But hopefully we can then manage it quickly.
Okay, thank you very much.
I'd just like to add one final point, Carrie, and I think this is a really important thing that some patients may or may not be aware of. So if a patient goes through the bowel screening and has a negative FIT test, that's very good. However, they subsequently develop symptoms. So let's say a week after your FIT test, or a month afterwards, you develop some bleeding in your tummy, or your bowel habit changes, or you start to lose weight, or you get tummy pain. Then I think it's really important that the patient doesn't think, oh, well, I've had a negative FIT test, I must be fine. No, you need to go and see your GP to have that investigated. Just because you've had a negative FIT test doesn't mean something can't happen later. And if you have symptoms, they should always need checking out.
Thank you.
Thank you.